Intermountain Healthcare has an important message amid the uncertainty of COVID-19 and a vital message about gun safety. Catherine Richards, Intermountain Healthcare Community Health Personnel. Catherine, this is such an important message as more and more people are isolated for extended periods of time. Catherine.
Yes, thank you so much for having me and for letting us share this important message. This is really a time of uncertainty and instability for people, and we understand that people feel unsafe and that they want to protect their families. And one thing that we're seeing in the community in response to this instability is we're seeing a rise in the retail purchase of firearms, and a disproportionate number of those purchases are by first-time gun owners.
And so with this instability, people may feel the emotion of desperation. And when we talk about suicide numbers, this is something you want to address because we want to tell people that there is, during the crisis, to keep those guns away from those people most affected and at risk.
Correct. Yeah. We want to both acknowledge that people are feeling unsafe and that there are other ways that they can be protecting themselves and their families. Some of those things might include, staying at home, social distancing, making sure that we're washing our hands, and even creating a family household emergency safety plan. And one thing that we really just want to remind people is that because of the instability, there will be a heightened mental and psychological distress among people, and that can result in a suicidal crisis. And one thing that we know about suicidal crises are that they're unexpected, they're brief, and they don't always happen with people who have a mental illness. So it's important for us to be prepared at any moment for a crisis to come up, especially in light of what's happening right now.
In fact, I've done stories on this. Intermountain for several years now has a program that brings gun owners, gun stores, politicians, lawmakers, and healthcare workers together to address the mental health, the suicide, and guns in these hands.
Absolutely. We see it as our #1 priority to be collaborative with those community members. We work incredibly closely with policy leaders. We work really closely with gun owners themselves. We have a phenomenal relationship with the Sports Shooting Council, the Shooting Sports Council. And we really see this as saving lives matter. It's not an anti-gun or a pro-gun. This is simply about saving lives, and we know that we can do that together. Utah has an incredibly high rate of suicide, and we know that a really big number of those suicides are by firearm.
Catherine,
and so we really
thank you
see this
so much for that message, because it is so vital. Hopefully someone out there who's listening to this interview could potentially save a life. That number there on your screen, it's 800-273-TALK 8255. We're going to have a link on our website at abc4.com. Thank you so much, Catherine.
Thank you.